sharper,
A revolution in learning. Cervical vertebrae. There are 7 cervical vertebrae in vertebral column. The 7 vertebrae are commonly identified or characterized by small size, by the presence of a foramen in each transverse process, foramen transversarium. Spinous process is short and bifid. The vertebral foramen is triangular, and it has concave superior surface and convex inferior surface. A short recap to have a clear idea. The 7 vertebrae are commonly identified or characterized by Number 1. Small size. 2. The presence of a foramen in each transverse process. 3. Spinous process is short and bifid. 4. Vertebral foramen is triangular. 5. It has concave superior surface. 6. It has convex inferior surface. In cervical vertebrae, atypical vertebrae are C1, C2 and C7, and the remaining are typical vertebrae C3, C4, C5 and C6. Atypical vertebrae, C1 vertebra, also called the atlas, is a ring-shaped bone that doesn't have a body or a spinous process. So, instead of a body, it has paired lateral masses that serve as a body. The transverse processes of the atlas arise from the lateral masses, so these processes are placed more laterally. The lateral masses have 2 superior, concave, kidney-shaped facet for occipital condyle. Facet for occipital condyle articulate with the occipital condyles to form the atlanto-occipital joint. The anterior arch and posterior arch extend between the lateral masses and form a complete ring. The anterior arch has an anterior tubercle and a facet for the dens, and the posterior arch has a posterior tubercle and a groove for the vertebral artery. On the anterior arch, there's a tubercle for the transverse ligament. The transverse ligament extends from one lateral mass to the other lateral mass on the atlas. Now, a quick recap. Number 1, it is a ring-shaped bone. 2, no body and no spinous processes. 3, it has paired lateral mass. 4, transverse processes arise from the lateral masses. 5, it has 2 superior articular surfaces, which articulates with occipital condyle. 6, it has the anterior arch and posterior arch extend between the lateral masses and form a complete ring. 7, it has tubercle for transverse ligament which located at anterior arch. Next, C2 also called axis. It has a dens or odontoid process, which projects superiorly and articulates with the facet of dens in the atlas. There is no intervertebral disc between the C1 and C2. It also has 2 superior articular facets on which the atlas rotates. It also has inferior articular processes and transverse processes similar to the other cervical vertebrae. Finally, C7. It has a smaller transverse foramen than the other cervical vertebrae, and it is also called the vertebra prominens due to its long spinous process. It is the most prominent spinous process, and you can actually feel it if you run your finger and press along the midline of the back of your neck. Guys, thank you so much for watching this video. If this video is good, like, comment and share. If you want to see more videos like this, subscribe to our YouTube channel.